What to expect during a brain tumor PET scan. Imagine a test that looks beyond the structure of your brain and instead shows how your brain tissues are working. That's what a brain tumor positron emission tomography scan does. It uses a tiny amount of radioactive material called a tracer to highlight areas of increased activity, which can be linked to tumor cells. Unlike MRI or CT scans that show the shape and size of a tumor, a PET scan reveals how active the tissue is, helping doctors understand the nature of the tumor and plan the best course of action. Before the scan, you will receive instructions to prepare. Usually, you will need to fast for about 6 to 8 hours, meaning no food or drinks except water. This helps improve the accuracy of the scan. It's important to tell your healthcare provider about any medications you are taking, especially if you have conditions like diabetes or are pregnant. You might also be asked to avoid eating carbohydrates for a day before the scan, as this can affect how the tracer works. Arriving early, about 15 to 30 minutes before your appointment, allows time for paperwork and preparation. You will likely change into a hospital gown and remove jewelry or metal objects that could interfere with the imaging. When it's time for the procedure, a technologist will insert an intravenous line into a vein in your arm, usually inside the elbow. This is used to inject the radioactive tracer. After the injection, you will be asked to relax and stay still for about 30 to 60 minutes. During this waiting period, the tracer circulates through your bloodstream and accumulates in areas of high activity, such as tumor cells. It's important to limit movement during this time to ensure the images are clear. Once the tracer has had time to settle, you will lie down on a narrow table that slides into the PET scanner. The scanner is a large, tunnel-shaped machine. You will need to remain very still during the scan, which typically lasts between 30 and 60 minutes. The scanner detects radiation emitted by the tracer, creating detailed images of metabolic activity in your brain. Sometimes, if your doctor is assessing specific functions like memory or language, you might be asked to perform simple tasks such as reading or naming objects during the scan. After the scan, the technologist will review the images to ensure they are clear. The radioactive tracer used is very low in dose and usually leaves your body quickly. To help flush it out, you will be advised to drink plenty of water. The images will then be analyzed by a radiologist, and the results are usually sent to your healthcare provider within a day or so. The entire process, from preparation to review, generally takes about 2 hours. PET scans are considered safe for most people, with minimal risks. However, if you are pregnant or breastfeeding, it's important to inform your doctor, as the radioactive tracer might pose some risks. The procedure is non-invasive aside from the Roman 4 injection, and it provides valuable information about how your brain tissues are functioning. This information can help your medical team diagnose the nature of a brain tumor and plan appropriate treatment strategies. In summary, during a brain tumor PET scan, expect to follow specific preparation steps like fasting, undergo an injection of a radioactive tracer, wait for it to circulate, then lie still during the scan itself. Afterward, staying well hydrated helps your body clear the tracer. This test offers crucial insights into tumor activity, supporting accurate diagnosis and effective management of brain health. Always consult your healthcare provider for personalized advice and to understand what's best for your individual situation.